On the 10th of September, New South Wales Premier Gladys Berejiklian made the surprise announcement that she would be ending the daily press conferences on Sunday, the 12th of September.
From next week, I don't know how this will be received, but the 11 a.m. information will be done by health staff through video link as occurred before, and Minister Hazard Orai will intermittently hold press conferences as required. So the weekend, Sunday will be the last day we officially do the press conferences in this way.
At best, the announcement was badly timed. It came one day after the release of the state's Roadmap to Freedom. It came 4 days after the Premier released some of the modelling that she had been using as the basis for saying that September and October would see the peak in the state's cases and hospitalisations. The problems with the roadmap itself could fill a video series of their own, but this probably best sums things up.
Well, can I say, I prepared the roadmap, I brought the roadmap to the Crisis Committee, I prepared the roadmap.
While the modelling released by the Premier on the 6th of September painted a grim picture, the reality is, given the limited scope of the data released, things could get much worse. Why do I say that? Firstly, the data that the Premier released was focused on local government areas of concern only. It did not look at the state as a whole. The Burnet Institute confirmed that they had prepared predictions on the statewide peak of COVID cases, and not just the local government areas of concern, but it was up to New South Wales Health to release the data. For a government that claims absolute transparency, refusing to release all the data does not appear to be the most transparent behaviour.
We have been so transparent every day.
Secondly, the modelling done by the Burnet Institute was based on current restrictions remaining in place, and did not account for the relaxing of restrictions that were announced as part of the government's reopening plan. As you could probably have predicted, the Premier's announcement that daily press conferences would end threw the press pack into a frenzy. By and large, Gladys has had a fairly easy run with the media in comparison to premiers of other states. By making her announcement, had she bitten the hand that feeds?
Please don't shout, I can hear everybody. Yep.
Difficult and dire situation.
Yep.
We know that the next few weeks, next month, we're going to see hospitals come under the greatest stress
Yep.
we've ever seen. And you and your ministers are about to disappear off camera and cancel this press conference. Are you going into hiding? Why?
Not at all. Can I just say very, very clearly and loudly to the people of New South Wales, we will be here whenever we need to communicate something very importantly to the community. I will make sure that we are, but what we also need to do is all of us have to start accepting that we need to live with COVID. Because COVID will be around for 3 or 4 years and it's not practical to do everything the same. Well, we will never know when that is. But we will never know when the peak exactly has hit. We know what the modelling tells us. I can assure the people of this state, I think they can judge me on my record. All of us have to start thinking about what living with COVID means. New South Wales prides itself on having the most transparent information available. Of course, accountability is something we live with 24/7. You'll still see me a couple of, quite frequently every week talking down the camera. I had some of you complaining that every day was too frequent. We have the most transparent information of any state. I don't know if any other state government goes through the daily information we do, as well as the vaccination rates, as well as, regrettably, the people have lost their lives in their circumstances.
Morning, everybody. I'm right to go? Yep. Thanks very much for joining us. There are 221 new cases of coronavirus today. That takes the total number of cases to 1,920 active. Just again to give you the age range, 86% of all active cases are under the age of 50. There are 120 people in hospital, 33 of those are in intensive care and 15 of those are on a ventilator. Yesterday we had some 42,429 test results come back to us overnight. In terms of vaccinations, we have the biggest day ever yesterday, our biggest day ever in our state-run hubs. 36,716 doses were administered on record. That's 2,680,174 doses that have been administered in our state clinics. We are, as a state, we're at 62.2% first dose. and 38.6% fully vaccinated. There were 73,000 bookings made yesterday. There are more than 10,000 first dose AstraZeneca appointments available over the next 7 days. Of the cases that were in hospital yesterday, 87% of them were not vaccinated. 13% were partially vaccinated. In terms of regional Victoria, there are far less cases in regional Victoria than there are in Melbourne. Outbreaks have been brought under control.
We have the most transparent information of any state. I don't know if any other state government goes through the daily information we do, as well as the vaccination rates, as well as, regrettably, the people have lost their lives in their circumstances. Oh no, we will continue to publish case numbers every day until at least 70% double dose or more. Well, we will continue to publish case numbers every day indefinitely.
Do you have at all a concern that the lack of this setup, which lots of people in the public tune into, is going to send that impression that we've reached a turning point in the pandemic that we haven't reached yet? And what other interactive modes of health communication are you looking at? Because a video posted with the numbers doesn't give people who are confused at all the chance to ask questions of the government.
Of course, but we never said that we would change this format every day. Quite the contrary. The 11 a.m. information will be done by health staff through video link, as occurred before, and Minister Hazard or I will intermittently hold press conferences as required. So the weekend, Sunday will be the last day we officially do the press conferences in this way. We will provide information that is best for the community. And I was very upfront and honest to say that whilst there will be ample information provided on a daily basis, I won't necessarily be the one providing that information on a daily basis. And that's because, as I've said, I need a clear head. The next 2 months will be the most challenging our state has seen, perhaps ever. Oh, look, as I said, I don't have anything to add on that matter. It would be appropriate to comment on ongoing investigations. I've been very consistent on that and I have nothing further to say.
Plot twist. What is the ICAC? The Independent Commission Against Corruption was established in 1988 as an independent organisation to protect the public interest, prevent breaches of public trust and guide the conduct of public officials in the New South Wales public sector. In August, 7:30 revealed that Premier Gladys Berejiklian intervened in the assessment of a $5.5 million grant to a shooting association in Daryl Maguire's electorate, months after he had written to her asking for assistance to fund the project.
Premier, you requested a reassessment of a $5.5 million grant that Daryl Maguire stood to gain a political benefit from.
Can you please stand back a bit? Thank you.
Why did you do that? And isn't that a serious conflict of interest given you were in a secret relationship with him at the time?
Firstly, the proposition you're putting is absolutely ridiculous. And second, all proper processes were followed, and that's all I say on the matter.
Well, Premier,
thank you.
We've seen the letters that you exchanged letters with Daryl Maguire about this project. You wrote to him, you thanked him for bringing it to the government's attention. Wasn't it a serious conflict of interest getting involved in any way in that grant process, given you were in a relationship at the time?
I refer you to my previous answer, and please respect this press conference.
Following the 7:30 story, a senior New South Wales government official publicly confirmed for the first time that a $5.5 million grant pursued by former MP Daryl Maguire was the focus of a corruption probe. Who is Daryl Maguire? Maguire is the former MP for Wagga Wagga. Maguire is also famous for driving tractors, as well as being in a close personal relationship with Gladys Berejiklian for a number of years.
I would like to say at the outset that Mr Maguire was a colleague of 15 years. He was someone that I trusted. He was a trusted colleague.
Ms Berejiklian, you should answer the question.
I am answering the question,
You should answer it directly.
Certainly, and
I'll give you an opportunity.
Yes or no answer.
Yeah, sure, and that developed into a close personal relationship. Yeah.
So is it right that at least as at the 13th of July 2018, you were in a close personal relationship with Mr Maguire?
Correct.
Is it right to say that you were in a close personal relationship with Mr Maguire from at least about the time of the 2015 election?
Or slightly after, thereabouts.
Slightly after?
Or thereabouts.
Is it right to say
to the best of my recollection? Yeah.
Is it right to say that at least before that period of time you at least had a personal attachment to Mr Maguire, even if at that point in time you weren't in a close personal relationship?
Yeah.
comment on the investigation. We're asking whether you've been called to give evidence at private hearings. So that's a yes/no?
No, as I said, it's inappropriate to comment on any ongoing matters, yes or no, and that's always been the proper way to respond to those questions.
The reason we are going to be seeing you less at the 11 a.m. conferences because you have been called to appear.
Oh gosh, I wish you could all be privy to the conversations we had about the ongoing 11 a.m. press conferences. And the Premier of the state should front to the people when she needs to, or when I feel I need to be accountable. I think people understand that I need to make decisions that are best interests of the state, and I think people would also trust that I would exercise good judgment as to when I should front, as opposed to other people providing that information.
Premier. You yourself being the one who decides when you will be accountable for something or not. How will people know whether there is something that they need to ask or they need to know about or that you need to answer to if you're the one deciding, yes, today I can be accountable, no, tomorrow I won't, particularly with Parliament not sitting?
Oh, I think that they're obvious questions, and I have a good team, and if it's a relevant minister outlining information instead of me for a particular day, I think that's completely acceptable.
If someone is a person of interest to the Independent Commission Against Corruption, can they still sit in Cabinet in your view, or is there no room for anyone in your Cabinet?
Oh look, I've made my position on those matters very clear in the past, and I don't have anything new to add.
What is your position?
If you or anybody, any of your ministers are named as a person of interest in private hearings or they're subject to investigation, do you think that information should be made public?
Oh, look, I'm not going to venture into hypotheticals, and I maintain the same response I provided previously.
Noting that John Sidoti resigned from the front bench when an investigation into him was announced, if someone is under investigation by the ICAC, can they remain in Cabinet or not?
Nothing has changed in relation to that matter.
Any questions on the pandemic? Do you believe that the public has a right to know if their Premier or a member of her Cabinet is before ICAC?
Well, they are matters for the Integrity Agency, absolutely.
Thank you.
Thanks, everybody.
Hello, darkness, my old friend.
After the announcement from Gladys, I made a tweetie. I sometimes do the tweets. I suggested that the opposition should do daily press conferences at 11 from Monday. Then, 2 days later, that is exactly what they announced. Could it be because of me? Am I taking credit? Sure. Why not? The opposition's announcement did exactly what I had suspected it might. It smoked Gladys out of hiding.
Good morning, everybody. Fortunately for New South Wales, our vaccination rates keep increasing. No, I was always scheduled to do today because of the key milestones we announced. The 11 a.m. information will be done by health staff through video link, as occurred before. The weekend, Sunday, will be the last day we officially do the press conferences in this way. Obviously, today is the first day. Many people have freedoms they didn't have before. And I want to stress that nothing has changed from my comments from last week. I'm on the job 24/7.
On the 13th, there were no questions asked in relation to the Independent Commission Against Corruption. This was especially shocking given that, earlier in the morning, news had broken that both the Deputy New South Wales Premier John Barry Lara and Jobs Minister, Stuart Ayres, were both reportedly summoned to appear before the Independent Commission Against Corruption to give evidence over the activities of Daryl Maguire. Fortunately, at least, there were a few other questions the Premier needed to answer.
You waited 2 days to lock down all of Sydney after New South Wales Health discovered it had failed to control the West Hoxton super spreader event. Why did you wait 2 days, and when did you first receive advice, verbal or otherwise, that Western Sydney and South West Sydney should go into lockdown?
Well, I think I've answered that question many times before, as has Dr. Chant, and I think you'd all recall that day where we held 2 press conferences. It was within hours of getting advice. Sorry, can you just let me answer that question, please? So it was within hours of getting the advice, and I want to make that very clear. But as we also knew early on, is that Delta is extremely different to anything we've experienced. the federal government's vaccination program, the way New South Wales has stepped up.
Within hours, you said that within hours of getting the advice to lock down, you were given a formal written advice to lock down. You say within hours.
I didn't say that.
You said within hours of getting the
I
advice
didn't say it was written
to lock
advice.
down.
Yeah.
So it was verbal advice. Just
well,
confirming.
Advice. It doesn't matter. The advice was
so
provided.
hours after giving the advice to lock down. How long after Health became aware of the West Hoxton party being something that they could not control, being a super spreader advice, was the lockdown? What is that time frame between West Hoxton setting off alarm bells and the lockdown being announced?
Well, quite immediate. I mean, the health experts.
What does that mean, quite immediate?
Well, we react to the health advice as soon as we receive it. And if we were, I could have waited an extra hours or an extra day, but I chose to come back on the same day and hold another press conference because as soon as we got upstairs, Dr. Champ provided us with additional advice and we reacted within hours. And look, I'm sure that people will have lots to say about how this pandemic is managed, and I'll leave it to the commentators. But I will say this.
21st, they thought they'd found everyone. On the 24th, they realised that there were people that they didn't know were there, that had been in the community for 5 days. On the 25th, the next day, you locked down the eastern suburbs, not West Hoxton, and it wasn't until the 26th that you locked down the whole state. Why did you wait between the 24th and the 26th?
Look, these are decisions we took based on the health advice. And again, there'll be people that said we went too hard and too soon. Others will say we were not hard enough. I mean, there are lots and lots of people who'll have an opinion on this. But what is the most important advice that I receive, the government receives, is from the public health team. And we knew early on, obviously, when the health raised the issues with us, how the Delta variant was difficult. And
Premier, you did know, that New South Wales Health did know on the 24th that there were several cases in the community, several attendees of the West Hoxton party in the community that they hadn't been aware of. Are you saying that it wasn't until the 26th, just hours before you called the citywide lockdown, that they advised you that they'd failed to control that outbreak?
No, I as I said, we have and I can't say this more proudly, criticise governments, but our public health officials are the best in the land. And
So, it was before the 26th that the Premier was advised that New South Wales Health had failed to control the West Hoxton outbreak. But the time between West Hoxton setting off alarm bells and the lockdown being announced was quite immediate, the same day the lockdown was announced. Can both those things be true? So, it has been a whirlwind few days in New South Wales. What prompted the Premier to make the press conference cancellation announcement on Friday? Was she trying to separate herself from being the face of COVID? Was she trying to distance herself from the peak in cases, hospitalisations and deaths that were predicted to be fast approaching? Was it to dodge difficult questions around the Independent Commission against Corruption? Was it to avoid questions about what actually happened at the start of Sydney's second wave? Was it all of the above? One thing I do know is, cancelling daily press conferences is a shrewd move if you want even more control over who is, and who isn't, invited to press conferences moving forward. It's all about transparency, right?
we have been so transparent every day. Right?